As it gets colder, some of us are noticing feelings of sadness or anxiety. Some people call it the winter blues, but the scientific term for it is seasonal affective disorder, or SAD. I'm joined by Stefanie, a licensed marriage and family therapist who's not only qualified to discuss relationships, but also well-versed in addressing seasonal affective disorder. Steph, can you tell us a bit about your experience in the field of mental health?
Yes. Hi. Thank you for having me. I have worked in community mental health for a number of years, and now I have a private practice, and I see primarily individual adults in my practice. I'm going to be talking to you guys a little bit today about seasonal affective disorder. And before I get into that, I also do want to say that while I am a licensed professional, this is not a replacement for a mental health treatment. So if you suspect that you are experiencing mental health challenges, I recommend that you talk to somebody in person that can help you out with that.
Can you provide sort of like a more in-depth explanation of SAD? Is it called SAD or SAD, by the way?
SAD is just an abbreviation for seasonal affective disorder. SAD was coined by somebody named Norman Rosenthal in 1984. He was a South African psychiatrist who wondered why he became more sluggish in the winter months after he moved from South Africa to New York. And those winter months look a little bit different. He did some research and he noticed, that there was this pattern of depressed mood in this particular season.
Are there like different factors? I know you touched on location, but can you talk a little bit more about that? Like why this occurs during a specific season?
Yeah, it's a great question. So if you think about winter months, which is where we're seeing it most commonly, you're probably not doing all of the hobbies that you might do in the summer. So you're maybe lacking interest in some things that you previously did like to do, or lacking motivation. You might feel more tired because it's getting dark earlier. You may be seeing your friends less often and isolating more. And so all of these things could make you feel kind of down. The other interesting piece of research that I've seen is that the decrease in sunlight during these months can cause serotonin deficiency, and things like serotonin can play a role in our circadian rhythm and how well we sleep. And so if you're not sleeping as well, that can really affect how you feel. That can affect your focus. That can affect your social motivation, a lot of things.
Speaking on like the lack of sunlight and how that can affect your mood, have you ever seen Broad City?
No.
It's a comedian TV show, and it's about these two girls, and one of them actually experiences seasonal affective disorder. And every time she starts to feel down, she like runs to a room and like puts this giant light on her face. Is that like an actually effective way of helping to treat those symptoms?
Yes, I believe they call it light therapy. And this was part of that Norman Rosenthal, who I spoke about earlier, who coined this term. From what I've seen, there's not like enough research where I could say like, yeah, like that's gonna cure you. But there are some people who really swear by it. That's something, with coping strategies, which I know we're gonna get into a little bit more later, is it's not necessarily about what works for everybody, but it's like what works for you. So if you find that that's something that helps you, I don't see the problem with that. I think it's a totally healthy thing to look at light a little bit as something really damaging about that. And if it makes you feel better, that's great.
Back, baby, I'm back.
Are there any eye-opening stats that you can dive into regarding those who experience SAD?
So what research shows actually is that there's a higher prevalence with higher altitude. So those are probably more extreme colds if you think about it. And also you're at higher risk if you're a younger individual of developing depression with a seasonal pattern.
Is that like the more proper way to say it? Depression with a seasonal pattern versus seasonal affective disorder?
Yes, but seasonal affective disorder has kind of made its way into the mainstream. And so I notice a lot of people will come in and say, I have SAD or I have seasonal affective disorder. And most, if not all, therapists are familiar with that term, but it basically is stating that you have depression with a seasonal pattern to it, meaning that more often than not, you're experiencing these symptoms within a particular season. And if we think about where it's most common, those winter months, you're inside a lot more, you're isolated a lot more. So we do see patterns of, changes in behavior during those months.
Is there ever an instance where somebody has seasonal affective disorder, like in summer?
Yes, absolutely. It's most commonly seen with a start around fall, winter, when it gets darker earlier and the winter months kind of get colder. and then a hard end usually around spring. But it can happen with any seasonal pattern. It could happen in the summer, it could happen in the spring. We just want to see that it's happening with some kind of a pattern. So meaning that within like a 2-year period, you're only having these episodes during particular seasons, not throughout the year.
I feel like identifying seasonal depression can be quite challenging for some people who don't have it the whole year. How can somebody distinguish between just typical winter blues and maybe like a more serious case of chronic depression?
Things like duration, intensity, the number of symptoms that you're having. There are 9 symptoms. You need to have had 5 of them happen for a minimum of 2 weeks in a row. And so those 9 symptoms are, number 1, depressed mood. So that can look like sadness, hopelessness, emptiness. 2 would be lack of interest, typically in things that you previously did enjoy to do. Now you no longer have an interest in them. 3, changes in weight. So weight loss or weight gain. 4 would be sleep changes. So insomnia, not able to sleep, or hypersomnia, sleeping more than you would need typically. 5 is restlessness or feeling just kind of really sluggish and slowed down. 6 is fatigue, low energy. 7, feelings of worthlessness or feelings of inappropriate guilt. 8, difficulty concentrating or struggling with indecisiveness. And 9 would be recurrent thoughts of death. And sometimes that is coupled with suicidal ideation. And the other piece I will say about that is while you have to have at least 5 of those, they also have to cause clinical significant impairment in functioning. So that means that you're not able to function in ways that you previously were. So maybe you're not able to get up to go to work a couple days out of the week, or you're not able to manage to get yourself to shower. Maybe things that you're trying to do to kind of get yourself out of it aren't super effective. Maybe they used to be effective when you were feeling down before, and now this kind of feels like I'm stuck here. Having winter blues and feeling down in the winter is probably pretty shared, but if you feel like, hey, I checked off at least 5 of those symptoms and I'm not able to function in the way that I'm used to functioning, you do want to talk to a professional and see if you can get it properly diagnosed.
Thank you so much, Steph. We really appreciate all of your insight and kind of that knowledge on depression, anxiety, and giving us some tips there. Do you have any last thoughts?
I wish everybody a safe winter. And if you do suspect that you're having any depressive symptoms or any other mental health symptoms, please seek a professional and get the help that you need.
Thank you so much, and I'll talk to you soon.
Great. Thank you so much for having me.